Hey guys, I'm presenting on my patient, Mr. Meng. He is a 38-year-old male. He had a physical for his current job, and the physician noted an enlarged liver and elevated liver enzymes, so he was referred for an evaluation. He is currently asymptomatic with hepatomegaly, which is the enlargement of the liver, and elevated ALT and SAT that was documented 6 weeks ago. He has no significant medical history or surgical history, and he takes no medications at home. He does use tobacco and he occasionally uses alcohol. His mother has diabetes and his father has hypertension and coronary artery disease. He is in no apparent distress and he is a 38-year-old overweight Korean male. His temperature is 98.7, his pulse is 77, and his respiratory rate is 12. Those are all pretty normal. His blood pressure is a little elevated at 142 over 86. His height is 5'8" and his weight is 205 pounds. His skin is warm, dry, with no jaundice. And his abdomen, he has a firm liver with a prominent left lobe and spleen tip. He has no ascites, masses, or tenderness. With the ultrasound results, they concluded that he has a loss of functional tissue of the liver. And what this is pretty much saying is that there's no masses, tumors, or stones in the liver that they found, and his flow velocity is normal. The gallbladder and pancreas are also normal, but the spleen is enlarged. For his diagnosis, he was diagnosed with hepatosplenomegaly, which is the enlargement of the spleen and liver, and hepatic steatosis, which is non-alcoholic fatty liver disease. Hyperlipidemia and hyperglycemia was also noted. For his medical treatment plan, he has to repeat labs and ultrasound in 6 months, and he was referred to outpatient nutrition for weight loss and nutrition interventions for his diagnosis. For his daily schedule, he has a good appetite and he works either day shifts or afternoon shifts. Whenever he works afternoon shifts, his big meal is in the middle of the day before he goes into work at 3 o'clock. So, for his breakfast, he has coffee with sugar and milk. At work, he has donuts or some type of pastry from the vending machines. For lunch, he has a sub sandwich or burger with chips or fries, a slice of pie or cookies, and that's from the work cafeteria with a soda. For dinner, his wife prepares his evening meal. She also does the grocery shopping. He usually eats meat with 1 or 2 cups of short grain rice, vegetables, kimchi, and usually some type of fruit. For his bedtime snack, he has chips, cookies, and popcorn. He has no known food allergies and no previous nutrition therapy and no vitamin or mineral intake. For his lab results, his glucose is elevated, and that just means that he has a large intake of processed foods and carbohydrates, and his body's not properly utilizing the glucose. He has an elevated ALT and SAT, which signifies liver damage. He has a high amount of cholesterol. He is at 285, so anything above 200 is increased risk for disease development. He has a low HDL and a high LDL and VLDL because of his diet. That's high in saturated fat. And he has a large LDL to HDL ratio. He also has an elevated triglyceride, and that increases his risk for heart disease, and high hemoglobin, and that's because he's pre-diabetic.